Thanks for joining us. With me, Russell Kane and Jackie Smith. Today, we're helping the nation's snorers and, of course, their long-suffering partners. There are around 15 million people who snore in the UK. Dr. Hussain is here to help.
I'll be telling what causes it, how to remedy it, and when you're snoring might mean you need a trip to go see a GP.
Dr. Hussain, can I just ask you a bit about this in terms of, you know, that there are certain things that change in your life as you get older, and, you know, Russell mentioned hearing and sight, but would you be concerned about this, and do you think there should be medical checks?
So there are already a number of medical checks, and I've done many of them for patients, but at the current position, it's when there is a concern raised. So maybe the patient reports a concern, or they're diagnosed with a condition which means that they need to have an assessment. And there's lots of really detailed advice out there for particular conditions as to how long you should be off driving and what precautions need to be taken when you re-enter. Now, I don't think there should specifically be an age where it's banned. I think that's wrong, because I see 95-year-olds that are really active and doing extremely well and cognitively very sharp, probably sharper than me. But I also see younger patients that I probably wouldn't want to drive either. So it's a balance. I think that 70 as a cut-off for doing that assessment every 3 years is right, because normally there are, as Russell rightly said, decreases in hearing and sight that needs to get assessed. But my concern is that it's self-reported at the moment.
Yeah.
And I think we should maybe look to bring more medical assessments into that, just routinely, not to ban them, but just to assess.
We're going to talk about snoring now, not because we're bored of Russell's jokes, but because we are a nation... I'm being really mean to Russell today. I love him, really. Yeah, you've snored through a few of my interviews and you can. I'll give you that. No, but we are a nation of snorers. In fact, there are approximately 15 million snorers in Britain, and of course a lot more people also affected by it if you share a bed with someone who snores. So Dr. Hussain is here with the tips that might help. So I think we all know what snoring is, but what is the kind of medical definition of it?
Yeah, so it's noisy breathing, which happens because when we're asleep and our muscles relax, our airways naturally close up because they're held up by muscles. They're not rigid in that sense. So, for example, if you've drunk a bit too much alcohol, if you've taken sleeping tablets, or if you're really exhausted, often you'll notice your snoring's worse, and it's just that loud airflow from vibrating airways.
Yeah. Some people say as well that your weight can impact it. If you're overweight, can that increase your chance of snoring?
Yeah, that's one of the big risk factors, and it will vary from person to person how much weight you need to have for it to cause an exacerbation of your snoring. And it's all based on the structure of your airways. Now, many parents will know that kids are often loud snorers, and that's because they have narrow airways and big glands like tonsils and adenoids. So definitely people are more susceptible, but increased weight does that. Other people to consider are those with chest conditions like asthma or COPD, and people that have anatomical differences like Down syndrome, where they have narrower airways.
Oh, okie-dokie. Now, there's lots of hacks doing the rounds, which are meant to help, aren't they? I want to know if any of these actually work. So first up, we have a hack involving a tennis ball, which, to be fair, looks very uncomfortable to me. Let's have a look at it.
Stay off your back. You can do this by putting a tennis ball on the back of your shirt to encourage you to sleep on your side.
So the idea being that it's so uncomfortable it'll force you to sleep on your side?
Yeah, do you know what? This is actually on the NHS website as potentially... Yeah, surprisingly. And they say that you should stitch it into your sleepwear.
Stitch it into your
sleepwear? Absolutely, yeah. Do you know, I actually, you know, when in my younger career, I did ask a few patients to try this out, and we got a resounding no for the success rate.
Did you?
Half the time it would come out, the other half the time...
It's quite good for, like, a massage.
That's the thing, yeah. People would just keep sleeping on it.
Yeah.
And they'd either wake up with a crook in their neck or feeling like they've had a great massage. So,
yeah.
Snoring, I'm not so sure it's going to help.
Okie doke. Should we talk about another one then?
Gone.
That tennis ball's gone now.
Is it? Who knows where it's gone? Will we find it?
Balls, please.
Right, back to the serious stuff. The next hack uses tape, doesn't it, this one, to stop the snoring. They're completely covering their mouths with this. Let's have a look.
One, applied right in the middle. But it doesn't stick, so you usually have to do one.
And your
right
mouth is still kind of openish.
So you got to use
And three. That's insane.
And I have pictures where that's what I had to use to tape my mouth shut.
OK, again, I mean, this doesn't sound
It
brilliant.
looks like he's getting himself ready for a hostage situation.
Yeah, it just...
So for people where the snoring is coming from, let's say, the mouth, maybe it's due to a large tongue or narrow airways at the back of the pharynx there, technically, closing your mouth and breathing for your nose is going to help with that. Now, the concern I have here is that blocking off an airway means that you only got one potential airway. That if that gets blocked up, let's say you have a really bad cold, it's quite often that our nose will get blocked off. You're going to be suffocating in your sleep. So I wouldn't recommend putting tape on for many reasons, and that would be one.
Should we talk about the things that do work, then?
Yes.
What are the products that do work?
We have a few products here. Now, depending on where your snoring is coming from, it could be, for example, from your nose, if you suffer with hay fever or allergic rhinitis, then nose straps or nose dilators. I'll pick one up.
Are they
here.
those things that go across your nose?
Yeah, so the nose straps, the ones that go across the nose, often you'll notice athletes will wear it because it just helps the airflow. It's just structurally trying to open up the airway. So if it's held up open, less chance.
So is it holding up the...
It's the nostrils.
Right.
So this is only if your problem is nostril related. Because what you need to use if it's a problem with, let's say, a large tongue or issues there, is instead use sort of mouthpieces. Now, this is a mouth guard that you use for if you have, like, grinding your teeth, but you can also get mandibular displacement devices where there's holes through there to allow air entry. Now, the issue with these is that they can be quite uncomfortable and people don't tend to tolerate it for long and they tend to give up. A final thing here is we got a chin strap. Now, I was hoping that Russell was sitting on the sofa so that he could wear it, but unfortunately, the producers have asked me...
Come on, Russell, come on over, let's try.
Oh, yes, thank you. I was...
You know I don't like anything on my hair.
I didn't
or
want my colleagues to make fun of me. So what, Russell, we need to do is you need to put your chin there where the grip is and then put it at the top of your head. Just place it just a bit more forward. There we go. Top of your head, get these holes around your ear, either side.
That it?
And, very well-fashioned. And the aim there, apart from to look very unique, is to keep the chin up and to stop you from sort of the snoring being caused by the vibration
So it
there.
doesn't completely stop your mouth from being closed?
Exactly. If you want to take a breath...
Unfortunately, Steph, no. You wish.
How does it feel, Russell?
I could sleep with this. It's not... It's like a sort of bra for your chin. It's almost... pressure can be quite nice when you sleep, a little bit of pressure like that.
Yeah.
I can sleep, but I don't feel like it would stop me snoring, though, look. No problem.
Yeah, fair
Mine's quite deep, it's down here.
Yeah, but that tends to be the one that I generally avoid. And for price-wise, like, these aren't expensive. Like, for example, the chin strap, we're looking at £6, £7.
You can make that with a pair of tights.
I feel like it's like a cheap facelift or something.
What about the other things? Are they fairly relatively...
What we've got here, we've got the mouth guard, that's about £18. Nasal strips are £4. And if we bring in the pillow here, so this is what we call an anti-snore pillow, and it's positioned such that... Because when we sleep on a pillow naturally, our head goes forwards and that closes off our airway. Many of you that are first aiders will know one of the things you do to improve the airway is to sort of put the chin back, open up the airway. So that's kind of what this sleeping pillow's trying to do. It's trying to just open up there.
You've always wanted to be a medical mannequin, haven't you?
I have, yeah.
Do you want to go back to your seat now?
Yes, thank you. Thank you, Master.
Oh, so I was enjoying it.
I know... When we said we were talking about snoring, I know you were chatting to the lunch mates, weren't you, about this as well, and just finding out what kind of questions people had. And I know you had a chat with Nick and Linda about it. Do you want to just say on air what you guys were talking about off camera?
Yes, we're talking about our daughter, Grace, who's 6, who does snore, or is quite a loud sleeper. She's got Down syndrome. She'll occasionally, especially if she's congested and suffering with a cold, she will, like, pause and gasp. So there are times when she's got a cold particular, I'll have my ear to the door and be listening to her breathing more. So we were just discussing, you know, what it is. Is that normal and something... There's so many things where we're just like, is that part of Down syndrome and you just go with it and wait till she's bigger, or are there things that we can do with that for her?
Yeah, really good to know.
It's a really good point. And you mentioned there a key symptom there, which we call apnea, which is the pauses in breath. And this isn't something that we want to see. And if we're having too often periods of apnea, those pauses in breath, they can have impacts on our health. Absolutely, Down syndrome, unfortunately, is a condition where you do get narrow airways. So coughs, colds, those kind of things can exacerbate the symptoms more than you would see otherwise. So really important that you raise those kind of symptoms up, and I'm really glad they did, because that will need further assessment for sure.
Yes, so you guys talked about going to the doctors, didn't you, to find out more about it. Can I ask a bit about sleep apnea?
Yeah, so it's called obstructive sleep apnea. And in the title, you've got pretty much what it is. So we get the obstruction, and that could be either the nose, mouth, or deeper down. And it leads to a variety of symptoms. So I'm going to split them into 3 groups. Our first group are symptoms that cause events during sleep. And this could be snoring, like we've talked about, but also those witnessed pauses in breath. They could be a few seconds, they could be longer. And you can also sometimes get choking with your breathing. If you listen carefully to your partner that snores, just make a note to see if you hear louder and louder snoring and then just pauses, where they then take a big gasp of breath. We don't like to see this, because it means that the body's going to start to starve of oxygen, and that can lead to more longer-term issues. The next set of symptoms is effects on the quality of sleep. Because if you're not getting good flow of sleep, that will impact you, make you feel tired, insomnia. You're going to get maybe difficulties falling to sleep or getting back to sleep. So look out for those. And then the final set, I call them the wild card symptoms, but they're often symptoms that people don't relate to. So it could be waking headache, urinating at night, and also memory impairment. These are all causes of prolonged sleep exhaustion. Because people don't realise that they're not getting good quality sleep. They may be trying to sleep for 8 hours, 9 hours, but they're not getting adequate air in.
And there'll be a lot of people who don't even realise they snore. You often hear that. I know Freddie said it earlier about when we said, do you snore? He was like, apparently. And that's the thing, there's lots of people who don't realise.
There's lots of people in denial, isn't it? But if you ask the partners, then the truth comes out. And 5% of the UK population have obstructive sleep apnea and are undiagnosed. And you may think, OK, well, it's just going to cause tiredness, etc. But this is believed to cause half of the cases of high blood pressure where we aren't able to control it. It increases risk of stroke, heart attacks, type 2 diabetes. It's a condition that is currently very silent, and we need more patients to look out, and particularly the sleeping partners, to warn them of those kind of symptoms when they notice it.
Yeah, really important stuff. Can I just ask, while we've got you, Doctor, there's always some medical thing in the news we need to ask you about as well, but there's quite a concerning story about the contraceptive pill, isn't there, and links to breast cancer. Can you just explain what's gone on there?
Yeah, so there was a really big study looking at about 30,000 women that were on the progesterone-only hormonal contraceptive. Generally speaking, for hormonal contraception, there's 2 groups. There's oestrogen and progesterone, and then there's progesterone only. And for a long while, we've known that oestrogen and progesterone does increase your risk of breast cancer by a small amount. It was thought that progesterone only didn't cause that, but this study has demonstrated that potentially it does for a time while you're taking it and for 2 years afterwards. Now, this risk we should put into context. So it's mainly seen in those over 30 that are taking it. And for every 1,000 women that take progesterone-only contraception, there will be 2 to 3 extra breast cancer cases. Now, I know that even 1 or 2 is not great, but this is small, and all medications do have an impact. And it's a bit of a pros and cons, because it does reduce your risk of womb and ovarian cancer.
Right.
So it's not sort of as simple as this is bad. And the advice from the authors of the study is that we shouldn't be changing our practices, but if you do have concerns about maybe your family history of breast cancer, etc., and you are on progesterone only, speak to your healthcare professional.
Yeah. Okie dokie, Doctor, thank you very much. As ever, loads more still to come. We'll see you after the break.